what does DBT therapy or dialectical behavior therapy actually help with? Is it just borderline personality disorder, or are there other things that DBT can help with? That's the question we're going to answer in today's video. But before we do, if you haven't done so already, please do go ahead and subscribe down below. Hit the thumbs up button on this video. And for those of you who have not been here before, my name is Matt. I'm a therapist and the owner of Progress Therapy. We are a group practice located in New York City. We help people with issues like ADHD, anxiety. We also do ADHD testing. We work on executive function skills. We do all sorts of things. If you're interested in learning more about our practice, you can check out the link down below in the description. But without further ado, let's jump into today's video. So people often think about DBT as the mainline treatment for borderline personality disorder. This makes sense because sometime in the 80s, Dr. Marsha Linehan developed DBT to treat borderline personality disorder. That was the main focus of DBT treatment when it was first developed. However, since that time, DBT has shown to be effective for many other issues than just borderline personality disorder and the associated symptoms. And when I say shown to be effective, I don't mean anecdotal information. I mean research, evidence-based. Behavioral Tech, which is the institution that trains people in DBT, it's like the official trainers of DBT. They actually have on their website a list of other conditions that DBT has shown to be effective to treat in at least one randomized controlled trial. A couple of the other issues that DBT helps treat are ADHD, PTSD, major depression, bipolar disorder, binge eating disorder, bulimia nervosa, substance use disorder, and others. And in addition to these conditions, if you go on Google Scholar and search for DBT treatment of, you're gonna find a lot of research that shows the effectiveness of DBT for a variety of issues, anxiety, panic, all sorts of things. Now, the body of research and the evidence that DBT is helpful for mental health continues to grow. And the list of conditions that DBT shows to be helpful for also continues to grow. It's really important to stay up to date on these things so that we know exactly what we're getting into if we decide to start DBT treatment or engage in DBT therapy. I just wanted to add a couple of comments on why DBT is so effective for so many issues. And one of the major reasons is because DBT is not only theoretical, but it's also actionable. Not only does a client learn a new way of thinking, but they learn a variety of skills and tools that they can implement into their daily life. I actually made a couple videos on DBT skills. One of them is the diary card and the other is the chain analysis. I'll post links to those videos up here somewhere. There's also links to the blog post about those as well. Those will be linked down below. If you wanted to see what some DBT skills are like, go ahead and check out those links. And in addition, DBT is also multi-dimensional. There are actually 4 main pillars to DBT: interpersonal effectiveness, mindfulness, distress tolerance, and emotion regulation. And within each of these sections, there are dozens of skills that are taught. So for example, within the mindfulness section, dozens of skills. Within distress tolerance section, dozens of skills. So you have these 4 main pillars, and underneath there, all these skills. And in relation to that, DBT is broad in scope, right? So you think about a topic like distress tolerance or interpersonal effectiveness. These 2 topics are going to impact everyone, right? Every person, no matter what you deal with or struggle with, is going to need to learn distress tolerance skills, right? And same thing with interpersonal effectiveness. Almost anyone could benefit from skills that will improve interpersonal effectiveness. So DBT is targeting these very broad, almost universal issues that every person deals with, right? Now, I know different mental health conditions impact these areas in different ways, right? So for example, if we have ADHD, we're gonna have different issues with distress tolerance than someone else might be. However, at the end of the day, DBT is teaching a plethora of skills for distress tolerance. So whether you have ADHD and you deal with distress tolerance issues, there's gonna be a skill for you, most likely. Let's say you deal with anxiety and panic. Most likely there's gonna be a distress tolerance skill that works for you. So the point is that DBT skills are broad in scope, and they really target these universal issues that people deal with. And that is why so many different people with different issues benefit from DBT. DBT is one of the main modalities that we use at Progress Therapy. largely because it is effective. It actually works. A lot of our clients like that it's actionable. They can practice skills in between sessions and really hit the ground running in therapy. If DBT therapy is something you're interested in, feel free to schedule a free consultation with our practice. You can do so at the link down below. We'd love to talk to you more about DBT and how it might be able to help you. However, in the meantime though, I hope this video was helpful for you. I hope you learned something. And until next time, we look forward to seeing you soon.